we'll get started inshallah. Inna alhamdulillahi nahmaduhu wa nasta'inu wa nastaghfiruh wa na'udhu billahi min shururi anfusina wa min sayyiati a'malina. So tonight, it's a pleasure to see everybody here. We're gathered for another enlightening session as part of our Healthy Muslim series. This is a journey towards better health and well-being inspired by our faith. As the Prophet ﷺ, he said, "Al-mu'minu al-qawi khayrun habbu ila Allah min al-mu'min al-da'if." That the strong Muslim, in all of the facets, is better and more pleasurable to Allah than the weak Muslim. I'm thrilled to introduce our distinguished speakers, Dr. Albandar and Dr. Ahmed Jamal Nadeem. I'm just used to calling him Jamal, that's why I stumbled a little bit on his name. They'll be sharing their practical insights on cancer prevention. The Healthy Muslim series is a testament to our commitment to living a holistic lifestyle, encompassing physical, mental, and spiritual health. It serves as a reminder of the Prophet ﷺ's teachings on the importance of caring for our bodies and our minds. Cancer prevention is a vital aspect of our health journey, and tonight we have the privilege of learning from two experts in the field, mashallah. I have no doubt that their knowledge will empower us to make informed choices and take proactive steps towards a healthier future. As we delve into tonight's discussion, let us renew our commitment to our health and well-being, guided by the principles of our faith. Let us strive to be the best versions of ourselves, not only for our own sake, but for the betterment of our community and our society at large. And without further ado, I'll let the doctors take.
Assalamu alaikum everyone, my name is Jamal.
And I am Haidar.
So the goal of tonight is for us to learn something, but also at the same time kind of make it what we want to. So we have some things that are a little bit guided, but at the same time, I would love participation from those that are sitting here, because I think what you want to know is more important than what we think you want to know, because again, we rather know what you want to know. But we do have some guidance, so please ask questions. If there are specific questions about a particular case, certainly we can discuss them in private. This is intended to be a little bit more generic, but again, we want to know what you want to know rather than what we think you want to know. So let's get started.
So Jamal, what I want to know is cancer, is this a new phenomenon? Has it been around for a while? What does Islam have to say about it? What does Islam have to say about preventing it? So many questions. It's not enough time in the day and the nights, but let's do the best that we can to get through that. And, focusing on the prevention, because really the thing that we've noticed practicing oncology in this country is that 99% of the time, the focus is on treating what's already been developed. You have lung cancer, you have breast cancer, now what do we do? But before we get to that point, how about understanding what it is that we're dealing with, or should we, God forbid, be dealing with it one day? So tell me, has this been going on? What is cancer, first of all?
So let's start with what is cancer. There's a very common analogy that's used, and that's a car. Everything in a car has checks and balances. So when you press the gas, the car goes. When you turn the steering wheel, the car turns. When you press the brake, the car stops. So in a similar way, our cells in our body, every single cell, is guided by checks and balances. So in order for a cell, for example, in the bone marrow, to become a red blood cell, it needs signals from outside to tell it that we need red blood cells. So those signals that come to it help grow it, mature it, etc. So cancer, in a way, is that process that's kind of become distorted. So if a cell was destined to become, let's say, a lung cancer cell, but it decides that it doesn't want to do that, it wants to go in a different direction, and it doesn't wait for that signal to come to tell it to become a lung cancer cell, that's when things kind of go a little bit awry. The beauty of our body, and again, it's designed by we're designed to be a fairly complex being by the Almighty. There are checks and balances even when things go awry. For example, if a cell is noted to be not appropriate or malformed in any way, then there are other signals that kick in and that say, hey, listen, I don't think you should continue what you're doing, and tell it to stop, and we call that apoptosis. So there's ways that the cell can terminate itself.
So you're telling me that there's a balance, there's an equilibrium, and that it's not easy to disrupt that balance. Is that what I'm hearing?
Absolutely. We're actually designed to be very resilient. If you look at your kids, they can go through so much and still be smiling and be healthy. Similarly, our cells and our bodies can go through a lot without really showing signs of strain. But when those injuries continue to add on and on and on, that's when a normal, healthy cell can become what we call malignant or cancerous.
And one thing that I want to point out is, and we'll reference this later on, is that whether it's the food, whether it's the environmental factors, whether it's other things of that nature, we're looking to do our best to minimize these. The medical term is insults, but what it means is these changes in the system, in the body, the cells, the mutations. So there are things that we can do to help minimize that and prevent that. So just keep that in the back of your head too.
And honestly, minimizing that is much more important. So the second half is much more important, but I think it's good to first talk about what it is, but then we'll talk about how to prevent it. So again, going back to the analogy of a car, if you press the accelerator, it goes forward. But what if the accelerator is broken? It's always going forward. And that's where the dilemma lies, is sometimes there are malformations in the cells where they no longer wait for that signal to come from the outside. They just act upon themselves, and that's when things go wrong. Same thing with the brake. The brake is designed so if our body senses this cell is inappropriate and it tells it, hey, stop what you're doing, that's the brake. But if that brake is missing, then that cell has potential to become cancerous. So the analogy that we sometimes also use is the idea of a dandelion or a weed, any kind of weed. That weed by itself doesn't mean a whole lot, but that one cell could have gone rogue, and that's kind of the topic we're discussing. But that one cell then has potential to become many cells and keep growing and keep growing. So you were mentioning this earlier. Can we talk a little bit about the history of cancer? Is this something that we just discovered in the last 200 years, or is this something that's been around for a while?
Does anybody know of, or has anybody heard about a cancer being found in decaying or mummified corpses? Anybody, show of hands, is that news to anybody? If I don't see hands, that means that's news to you. So did you know? So basically we found tumors in mummies. We've seen breast tumors, remnants of it, that is. So they're not alive, right? But remnants of tumors. We've seen tumors on the bone, like literally bone tumors. Basically, we've seen cancers existing, evidence for it being thousands of years ago. So it's not a new phenomenon. It's not something that Allah subhanahu wa ta'ala has created now. However, with that being said, there are people that believe that there's evidence that there's more of it that's happening now than it's ever been happening before. So some of that could be that we're better able at detecting it. Some of that is, we're living longer. So as humans, we're not living 40, 50 years of age like we did hundreds and thousands of years ago, but now we're living to 70, 80 years of age. So there's more time to develop these diseases. But with that being said, there was cancer in the past. So what we have here is a fossil record which showed something called the osteosarcoma, which is a cancer of the bones, literally. And this was actually in a turtle 240 million years ago. So animals develop cancer because that's the thing that we find, that Allah subhanahu wa ta'ala has created disease, has created health, so that we can know and praise Him by these two phenomena, these dichotomies of the tall, short, blue, black, white, disease, health. And similarly, animals have diseases, humans have diseases, and this disease in particular, cancer, has been along for a long, long, long time.
So one of the slides that was listed, just to go a little bit more into detail. So how many of you guys have heard of Imhotep? If you watch some of the pop movies, you might have heard of him. Anyone have heard of Imhotep? He's the guy who was one of the original architect for the original pyramids. So he was a very talented man. He designed the pyramids. He was a physician to the pharaohs. He was man of many talents. So he's the one that has the first documented case of breast cancer, where he actually, I believe, diagnosed it in the queen at the time. And his response was that this is something that's going to end very poorly. Again, at this time, this is several hundred thousand BC, I think it was 2600 BCE, that he discovered this. And at that time, there was no notion of surgery, and he knew that this was not going to end well. So again, even in humans, cancer has been prevalent for a long, long time. So kind of going back to, so again, we want you guys to, if you have a particular topic you want to talk about, we can jump around a little bit. Is there something that kind of strikes out to the audience that's something they want to discuss? If not, we can kind of keep going.
Keep going.
Yeah.
Sir.
Thank you. It's a little bit out of line of your topic, but I think you kind of brought it up a little bit earlier with that fossil bone you showed, that cancer was found, more than 100 million years ago. So now that raised the question for me about how does that reconcile with the creation of universe that Quran, I guess, kind of talks about? So how do we reconcile that? Is it really true that universe has been there for that long, based on Quranic, I guess, histories that I've learned about? Just wanted to know about it, if you know.
So you're saying because they see the evidence of a tumor from 240 million years ago, or a creature, that the creation, you're saying about the creation of life at that time? I mean, we have evidence that the creation has been around for billions of years, not just hundreds of millions of years.
So I think Allah knows best. We don't know how old the universe is. We know that one time heaven and the dunya were one entity and they were separated, which some people believe that's the Big Bang, quote unquote. We don't really know how old the universe is. Only Allah knows the answer to that. So there are creatures that have been reported at 240 million years ago. But again, whenever I'm personally in the, when there's a little bit of discordance between what I'm reading and what we're told, the reality is science is malleable in the sense that whenever we get new information, all information goes away. So yes, while this may be supposedly 240 million years old, we don't actually know that. So if Allah tells us otherwise, the wisdom of Allah supersedes whatever science is saying. At least that's how I perceive things. Yes. Absolutely. Yeah, I think the Bible says this, that the world is only 6,000 years old, but we don't know, because that's not something that's described, at least as far as, like you say, in the Quran.
Yeah, as the brother is mentioning, the concept in the Quran of خلق السماوات في ستة أيام, this أيام, the yom, we've understood it to be a long period of time, so we don't know exactly how many years that is. So, barakallahu feekum, I enjoyed that back and forth. So, how much cancer is there out there?
So let's talk a little bit about statistics. So these are statistics that are a few years.
But the mic guy thought speak up a little bit louder. So people are like, I think if combined up. But I think what if I like to be take that disease and again that's sort of that and but then find it and then show. Yeah. Again, yeah. Anybody cares about the art can be done don't quality but it's in the detail wild dog but
So yes, while there are some variances within ethnicities, it is something that is very prevalent in men. And I think this slide highlights it very eloquently, is that yes, while prostate cancer is the most common cancer in men, lung cancer is still the most fatal cancer, irrespective. And same thing, if you look at the propensity of pancreatic cancer, it's not very prevalent. However, when it comes to mortality, it jumps to spot number 4 very, very quickly, even though it's less common. So there are cancers that are non-aggressive, and then there's cancers that are incredibly aggressive. So having a diagnosis of cancer in itself does not necessarily equate to that things are not going to go well. There's a lot we're learning within even each particular cancer that makes one behave better than the other. But this is just supposed to be generalities of different types of cancers that are out there. And then let's take a look at the statistics of Pennsylvania death. So this is pulled from 2023. This was just Pennsylvania alone. We had about 2,800 deaths, and most of them were colon and rectum, which is one of the more commons. And surprisingly, lung is actually quite high too. It's almost double colon and rectum. So lung still stays the most prevalent. And we can talk about that. That's in some of the things that we're going to talk about, is why is lung cancer so common. But the good thing is that all the things we are doing are working. Screenings are working. The treatments that we have now are superior to the treatments we had even a decade ago. So everything we're doing is actually improving the survival in different cancers. I'm intentionally not going into the details of some of these intricacies, and we can certainly talk about it if you guys want to talk about it. But the success of all the research that has gone into cancer is actually working. So let me ask you, so we've talked about what is cancer, how common is it, but how do we know we have cancer, or what causes cancer? Do we know what causes cancer?
So we have a lot of research that's gone into this, because this has been a key question that we are it's really important to know. There's a commonality. So each cancer that we have out there, there is a common denominator. So smoking, unfortunately obesity, not being as active, being sedentary, sitting down for long periods of time. These are things that increase your risk for most, if not all, of the cancers out there. There are particular risk factors that are that contribute more to particular types of cancers more than others. And then there's inherited genetic mutations. So for the sake of our conversation today, we're going to speak more about the commonality about all the cancers rather than pinpoint the specific cancers that are a little bit different. But alcohol use, particularly for cancers of the esophagus. So if your alcohol use increases the risk for this type of cancer and several of the other types of cancers. Drinking very hot liquids, scalding hot, that you burn, like very hot tea, you get a chance to cool down a little bit, very hot coffee, and then you feel it burn the bottom part of your throat. That's been shown to be a risk factor for one of the types of esophageal cancer, unfortunately. So we have people that we hear about, in our patients, anecdotally, who they never smoked, they never drank, and you can't identify really many risk factors. They are overweight, so that's a potential risk factor, and we'll talk about why that is. But they had a risk, they drank a lot of hot liquids, and they particularly recall having, you drink it really quickly, and then it burns at the bottom part of your throat, esophagus. That's a risk factor. So just something to bear in mind, to keep them. And the reason for that, is that it leads to inflammation in the bottom part of the esophagus, and that leads to changes in the lining of the cells there, and that those changes over time develop the mutations that develop into cancer. So what you see there in this list is exposure to something as simple as asbestos. So I'm sure a lot of us in the crowd have heard about asbestos exposure. Older homes that have you're doing work, particularly before 1970, 1960, it's in the walls, and then when you break down those walls and there's that little bit of fume, that increases your risk of lung cancers in particular. So there are a lot of environmental exposures that we have. Unfortunately, people that are living near particular rivers or factories, and the water is contaminated, and they have that in their drinking water, water. This is shown the heavy metals and other chemicals are carcinogenic, and this concept of carcinogens, things that you consume, are something that we're learning more and more about. So not just smoking, unfortunately, but things like processed foods, processed meats, things of that nature. You see the list there. I know it's a small list, but it says pesticides, preservatives. Some people think too much of red meat, but that's some of that could be from the processed aspect of things. Exposure to radiation, UV light more for things like melanoma, skin cancer, and so forth. And there's a lot of viruses that can contribute. So certainly exposure to certain viruses, particularly, there's a whole host of viruses, not to belabor the point, but you hear about HIV, but it's not just HIV. It's things like, that's common, like human herpes, one of the herpes viruses, human papilloma virus, and things of that nature. So a lot of those viruses are contributing. Sir.
Plastic,
Yes, so what they're finding wonderful question, Dr. Grenade. So we're learning more and more that things that, if you have plastic plastic bottles or plastic containing utensils or so forth, the chemicals are leaching out from there, and there's more and more evidence to support that. So we're not at the point where there's a recall saying the government saying don't drink from plastic at all, but, to be safe, that would be best right now to not to drink from these.
Absolutely. So this theory that plastic is causing some of these diseases is not new. In fact, I was very young. In 1996, I'm curious. So I went to a conference with my mother. I actually remember that in 1996. And at that time, they didn't have a word for what these chemicals are. So they called them plastids at that time. So they were even at that time showing that some plastids are linked to a lot of different diseases. So plastic water bottles is a very controversial thing at the present because unfortunately there's a lot of large entities that really don't want that researched because unfortunately there's a lot of financial incentive, not only for the companies that make the bottles, but the companies that sell the beverages, as well as some government entities that perhaps that's not something to evaluate. Unfortunately, that's always been a limitation in cancer research. Is there's a lot of big lobbies that do not want that information reviewed. So they kind of actively go against it. For example, even if we talk about tobacco, all the tobacco, entire tobacco industry and the lobbies, they've been actively fighting that tobacco causes diseases since the 50s because that's where they make their money. And if something worth noting is a lot of our junk food that we eat, they're actually owned by Philip Morris. So almost all the junk food that's out there is owned by big tobacco conglomerates. So Oreos is owned by Philip Morris. So even though they've kind of started to move away from smoking because there's now a big, somewhat of a taboo against smoking, they're still doing the exact same things to our present food. So yes, it hasn't been 100% proven that the plastic that's used in water bottles can cause cancer, but unfortunately there's other plastics that already, like BPA, that are known to cause cancer. So I think it's only a matter of time before we learn some of these things. Yes. Yep. It's known to cause liver cancer.
So,
Absolutely. Absolutely. So I'm going to just repeat what you said. So brother here is saying basically a lot of European entities are moving away from the common plastics we use for this exact reason. And unfortunately, I think in the US we're behind in a lot of these developments only because unfortunately sometimes the financial aspects outweigh other aspects in our society. But let's talk a little bit more about smoking because we were just mentioning that. Yeah. So again, a lot of this is controversial, but I think the less plastic you have in your life, the better the outcome.
So smoking is something that you know, this is probably easy for everybody to see on the screen, but take a look at, you know, we've been hearing this over the last, I'm sure everybody's heard a lot of this, but look at how many cancers and chronic diseases are contributed to by smoking. You have cancers from the head down to the feet, really. Head and neck, lung, leukemia, stomach. So it's not just lung cancer that you stereotypically think about, but it's also things like leukemia, which is a blood cancer of the white blood cells. Kidney cancer, it's very prolific in terms of developing that cancer. Colon cancer, pancreatic cancer, bladder. I mean, if you look at that list, what organ is not spared? This is basically what should come to your mind. Bladder cancer, cervical cancer. And then lots of heart diseases, lung diseases, pneumonias, increases the risk for fractures, decreases the strength of your bones. You know, you're more likely to develop bone thinning, osteopenia, osteoporosis, heart disease, plaque buildup of your arteries, and then heart attacks and strokes and so forth. So a lot of things that are very concerning on that list.
Cigarettes,
shisha, you know, all of these, of course, cigarettes are the worst, but the other ones have also the risks. And if you look at the FDA, you look at the CDC, they will list inhaled water pipe smoking, which is shisha, as one of the risk factors. So, you know, a lot of our youth, as well as the youth generally in this country and other countries in the world, they're engaging in that, saying it's not as bad as smoking, but really, you're not really that beneficial from a health perspective, unfortunately. So we talked about obesity. I want to go a little bit into that because that's what's going to come into a little bit later about preventative health. Obesity, if you're above your ideal body weight, what that does is you have the buildup of weight in the middle part of your body. They call it adipose tissue. Central adiposity is the term for it, but what it means is fat in the middle part of your body. Inflammation is a byproduct of that because there's hormones that are secreted in increased numbers when you have more, you know, in your gut, more in your thighs, and so forth. That's been shown to increase the risk of multiple cancers. So this list is hard for everybody to see, but you can see that really not many cancers are spared. Breast cancer, lung cancer, gallbladder cancer, cervical cancer, ovarian cancer, multiple myeloma, all of these cancers, the risks of you developing them are at least 2 times greater and up to 5 or greater times the risk of somebody who's a BMI index of less than 25. Of course, that index has its, it's not an ideal to use by itself, but just the idea is that the more inactive you are, the more that you're sitting down all the time, the less that you exercise, the more that you have caloric intake, the more likely you're going to have issues in your health, and it makes sense.
So I don't know if you guys kind of see this theme emerging, but whatever we're kind of taught in the Quran, everything in moderation, avoid things that are harmful to you, keep yourself healthy. All of these things actually are incredibly important when it comes to cancer prevention. Yes.
So we do know that refined sugars, processed foods, these are things that are problematic and can increase your risk. So certainly we want to be very wary of these type of products as well, certainly.
not at all things that was not what we are, but there's many more things.
Smoking is a greater risk factor, but this is another minor risk factor. So from that respect,
Yeah.
because when you think about it, a lot of the foods that you, from a biology perspective, things are converted into sugars, are converted into fat in the body. So some of it has to do with the sugar intake, but a lot of it has to do with what it does end up, what's the end product, is that you're developing the fat and the inflammation and so forth. Because you have to think about how do you develop the mutations or the changes in the cells that you lose that control, that cell cycle control that Dr. Jamal talked about earlier. So what symptoms can I be experiencing to be concerned that I might have cancer?
This can get a little scary because a lot of things sometimes are very common, and I will start by saying Do not overthink it. So if you're having fevers for a few days that you can't explain, doesn't mean you have cancer. If you have an enlarged lymph node, and lymph nodes are basically immune channels, for example, you can sometimes feel them in your neck. An enlarged lymph node does not necessarily mean you have cancer, but these are sometimes suggestive of cancer. So individuals who are persistently having fevers that are unexplained, changes in weight and appetite where they're losing weight or they're eating the same amount but still losing weight or unable to maintain weight, or eating more than usual and still losing weight, a lump somewhere, a cough that's not getting better. So again, a normal cough after infection can last for 4 to 6 weeks. That's not concerning. But if you have a cough that's ongoing for several months and you don't have a history of asthma or something, that could be concerning.
So this list, again, is not complete, and there's so many symptoms that could be typical. But if you're going to take only 3 symptoms to be worried about that are higher concern, I would focus on the top 3, as Dr. Jamal mentioned. So not necessarily fatigue, that's very non-specific, but unexplained weight loss, as he mentioned, unexplained fevers, as he mentioned, unexplained cough for many months. Those are very, very red flags. And everything else can, as he mentioned, can be non-specific. So,
and again, it's very site-specific. So if you have kidney cancer, your symptoms are going to be very different than lung cancer. You're going to have more potentially blood in the urine, things like that. So it's very specific to what type of cancer. Generally, if you're a healthy person, your chances of developing cancer are on the lower end. But if you're having a symptom that's bothering you, it's never the wrong answer to go see a doctor about it and say, hey, listen, what do you think about this? So again, although low probability, never the wrong answer. Any questions about that? Yes.
I've got a vaccine in the body together.
So I think I would love to see the research you have, but I will also say sometimes there's a confusion between causation and correlation. So certainly show me I would love to see the research, but analogy that we sometimes use jokingly is there's a lot of patients who have bread in their stomach when they die. It's just people were eating bread, but I do definitely, I'm not disputing it. I would love to see what you have. Okay. Okay.
I will say that we have seen some of these vaccines have, there's been blood clots associated with some of them, particularly the J&J one. But definitely we can take the conversation. I appreciate you sharing that. Thank you. Why does... Oh, shark. I don't know, to be honest. I don't know about that. I don't know. Allah A'lam.
The small stuff that you made.
Allah A'lam. One of the miracles of Allah subhanahu wa ta'ala. One of the miracles of Allah subhanahu wa ta'ala. They should study it more to see if there's something in the immune system for the shark. So that'd be something to look into. I don't know. No, I don't know. Yeah, I don't know. So how do we, I know everybody we want to get to the preventative when we're getting there. How is cancer diagnosed and how is it treated?
So again, you can be having symptoms that are suggestive of cancer. But again, ultimately, in order to diagnose cancer, the most important thing is having a tissue biopsy, meaning sample of the cells that are concerning for cancer. So if you think you have symptoms, then I think it is worth seeing the doctor, and usually we start with either imaging or some sort of visualization of the area of concern. So that could be starting with imaging, that could be a colonoscopy, whatever. But ultimately you need a tissue biopsy to determine whether it's cancer or not. And then there are additional tests that can be done. There are blood work that sometimes can show things. For example, if you have something going on with your kidney or bladder, it may show that your kidney function is not doing well. Or if something is going on in the liver, your liver numbers may not be doing so well. So again, it kind of is the context of everything else going on. And we can go further into this if we have time at the end. But the newest innovation that's coming out in the cancer world is circulating tumor DNA, where we can actually spot broken down cells and the DNA inside of them. in your blood to determine if the cancer is still present or if it has gone away. We can certainly talk about this a little bit more if we have time at the end.
So in terms of cancer, we think about it, different cancers are staged differently. Basically, not to spend too much time on this, but if it's localized, it's going to be stage 1 or stage 2 if it's a solid cancer. But if it's that stage 4 number, that means that a cancer has gone somewhere else in the body. And it's not curable, technically, but right now, even with cancers that are quote unquote metastatic, meaning it's spread, it's stage 4, it's gone to a different part of the body, we have people that are living much longer with advancements in terms of their approach to diet, exercise, and then the treatments we have available. Blood cancers are staged a little bit differently than solid cancers, because blood cancers, by definition of having a cancer that's circulating in your blood, it's circulating everywhere throughout your body. So the way that you look at that is a little bit differently, and that's what I think we'll say about that.
So we've talked a little bit about what is cancer, and I think one thing to note about staging and why we kind of include this information is that earlier a cancer is detected, the more likely it is that we can eradicate it or cure it. So that's kind of the reason we were talking about staging. So stage 4 cancers in general are not thought to be curable, but a stage 1 or stage 2 is generally thought to be fairly curable. But again, it's very disease and site specific. Yes? That's a wonderful question, and we are actually that's one of the things we're going to talk about is some of the innovations we've had. Maybe we can talk about it now. Oh, I don't know what just happened. Let's, you can go to the screen. Yeah, so we can actually go to what cancer screening and how that kind of works. So I will start by saying, yes, unfortunately, there's always going to be a little bit of a bias when it comes to seeing the primary doctor, because 99% of the time, that symptom that you're describing isn't going to be cancer. Same thing in the emergency room, because I've had patients that went to emergency room numerous times with the same symptom, and then the third or fourth time, the right test was ordered, and that's what diagnosed that cancer. So absolutely, unfortunately, our system is by no means perfect. And I will say that there are reasons on the other end as well where doing too many tests isn't the right answer either, because if you get an MRI for everything, then you are going to find things that are what we call incidental findings that are of no clinical concern, but certainly can raise anxiety. And that's where cancer screening comes in, because there are certain cancers where we know that different tests can help us determine that you have a cancer much, much earlier than before it causes those symptoms. Colon cancer being one of them. A tiny little polyp, if removed early enough, could have become devastating colon cancer, but now it's all your body. Same thing with a mammogram. If you do it early enough, you can eradicate that cancer before it ever became something aggressive, because a lot of the earlier stages of breast cancer are non-aggressive or even precancerous, and they're removed. But it comes at a cost, because unfortunately for every biopsy we do, there's a percentage of people that have that biopsy that was never going to be abnormal. So there's always going to be some people that do not, oh, sorry, if you can't hear me. There's always going to be some people that get a biopsy and it comes back normal, which is great for them, but it did create a lot of anxiety. So there is that financial cost, that anxiety. So there's costs to everything that are sometimes tangible and sometimes intangible. So over screening and over biopsying and over imaging has its consequences, but unfortunately, you're absolutely right. In our present era, and our health system is not the most ideal, we have missed a lot of cancers. And this this diagram is intended to show that there are benefits, there's harms, there's costs. And we use this number needing to treat, meaning how many people do we have to screen for our next cancer to find one that was concerning. So these numbers can vary drastically between different things. So prostate cancer, if you go by a blood test called PSA, you have to screen a lot of people before you find a prostate cancer. But with a colonoscopy, a polyp that looked cancerous, you have to screen a lot less people to get that answer. So it varies disease to disease. And unfortunately, as Muslims, we're not doing a very good job of screening. So this is a study out of University of Chicago by a Muslim physician, and they looked at individuals who were Muslim versus non-Muslims and how likely were they to get screened. And unfortunately, as Muslims, we're much more unlikely to get screened. And there's a lot of different thoughts that can go into this. And I think some of those are determined on the fact that there is some mistrust in society by our present healthcare, and I'm not going to dispute that. And I've kind of said it in some places where I disagree with how the present society is run. But I also think that we should make a sincere effort to improve all health literacy and improve our health as Muslims. So that's kind of the purpose of me showing this slide. Does that kind of answer the question? Okay.
Okay. Just go to time. Let's skip to. So we're going to go to prevention now. So we're going to jump into what. So look at that. Yeah. So how do we prevent cancer? I think that's what a lot of our minds, because a lot of the times when you have the symptoms for cancer, a lot of the times it is advanced. Particularly when it's lung cancer, particularly when it's colon cancer. When you're having symptoms, generally you're coming to a more advanced stage. You're not in the really early stages, stage 1, stage 2, generally stage 3, stage 4. So what can we do? So there are things that the only plug we're going to put Jamal and I about medicine before we get to prevention from a food perspective and holistic in Islamic holistic sense is aspirin. So daily baby aspirin 81 milligrams. We actually both independently, without each other's knowledge, did this almost the same study. His was a little bit better because it was a more meta-analysis, which for those in the crowd that know about research, that's better than a retrospective study. What we both looked at was this question about if you took aspirin, one aspirin a day, did it cut down your risk of colon cancer, of developing it? And we both found independently that there was a lot of evidence to suggest that yes, taking aspirin did decrease the risk of colorectal cancer. And there's actually other cancers that we have that we believe it cuts down the risk as well. I wonder if you want to throw in two cents.
And it's the same exact reason which we've been talking about. If you reduce the irritation, the inflammation in the body, then you reduce the stress on those cells and you reduce your risk of cancer. Some of the things that we wanted to kind of highlight is that, again, a lot of this guidance we received in our holy book and other places. So we're going to kind of highlight some of those things, and I'll let you kind of do some of these.
So we are a people that are big on fasting, are we not? We just came out of the month of Ramadan. So contemporary literature research has been showing that if you reduce your caloric intake, less food, intermittent fasting, or certain things along that vein, that shows that people are living longer. So there's studies that are being done more and more to show that, and some of it has to do with the telomerase, some of the aspect of the genetic material in your body in terms of everybody, you're aging, these parts of your genetic code shrinks and shortens every year that you live, basically. And that process shortens and is delayed and is slowed down by you doing no more and really no less than eating less. So that's something that's been very fascinating that we've been learning more about. So what does that mean for us? We have a tradition, don't we, to fast twice a week. 6 days in this month of Shawwal, which is about to run out. And, this is one of the things that we have going along those veins. And why is it? Why do people think that helps? So what it does is that it increases the cardio-metabolic factors in your body, improves your insulin. So every time that you exercise, there is hormones that are released, particularly insulin release, glucagon, and we can get into that into detail if we wanted to. But suffice it to say that your ability when you exercise and be active for the hormones to be more effective in your body, for the metabolic process to really burn calories and to convert fat and so forth, all of that is improved when you have a caloric restricted state. Now, I'm not saying that should be all the time, and that's definitely not what I'm saying at all, but to incorporate that somehow into your diet, into your daily lifestyle or weekly lifestyle, has been shown by lots of research that people have a lot of health benefits with this insulin sensitivity response. So now I want to get into food. So in the Quran, we have multiple foods that are mentioned, both livestock, but in particular food items. So we're going to talk about 6 of them and talk about why it is that we believe that these food items are beneficial, and the wisdom that Allah subhanahu wa ta'ala has provided that for us from that perspective. So the first one is dates. So Surah Al-Maryam, as well as other surah in the Quran, this is a food item that is rich in fiber, helps with your digestive tract, manganese, it has iron, magnesium, calcium, potassium, copper, and vitamin B6. A lot of the things that you have in dates, and as well as the other food items we're going to cover here tonight, are rich in antioxidants. So remember how cancer, it's pro-inflammatory, pro-oxidant, and in fact, treatments that people are doing today for cancers like kidney cancer, they're looking to target this reality that if you lower the oxidation level, and by having an antioxidant, that's been shown to be beneficial for things like kidney cancer. So the idea is that this is a food item that you have a bounty of antioxidants in there, and antioxidants have been shown to be very beneficial for things like heart disease, Alzheimer's, diabetes, let alone cancer. So we believe that that's one of the, these flavonoids, carotenoids, and phenolic acid, that's what's being beneficial. So having dates in your diet, you can remember to eat dates by fasting on a weekly basis, the caloric restriction, and then the dates that you get to eat as well. Corn. So in Surah An-Naba, verse 15, we have a reference to this, and basically we have a food item that's rich in vitamins and minerals, specifically vitamin C, numerous vitamin Bs. Vitamin Bs, you have things like B1, B2, B3, B6, so there's a lot of individual vitamin Bs. So corn has a lot of that, and potassium, and copper, and so copper is one of the main antioxidants that are in corn. And again, as we mentioned previous with the dates, this helps with heart disease, risk reduction, and cancer as well. Yes, sir.
So again, I think I tend to do things that are what I feel appropriate. I'm trying my hardest for my family to do as much organic as possible. I think the data is not there yet to support one or the other, but I think the more wholesome and more natural, probably more better. That's the way Allah had designed the food, and that's how I want to consume my food. So I'm favoring things that are more organic or things that I grow myself. I'm trying to grow my own garden so that I do get more, what I feel is more nutritious. And I will say, and again, I have bias, if you have lived somewhere else outside of the U.S., and if you've lived in the U.S., the fruits outside the U.S. are much more flavorful. The vegetables are much more flavorful. We have contaminated our food supply for the sake of profits. And again, this is my personal bias, and I think that's not appropriate.
And then we have ginger in Surah Al-Insan, verse 17. أعوذ بالله من الشيطان الرجيم. ويسقون فيها كأسا كان مزاجها زنجبيلا. So ginger is, we have lots of benefits in terms of, again, from the GI tract, digestion, and there's a lot of health benefits when you're ill. So from common cold, viruses, flu and common cold, opening up the airways, as a decongestion and so forth. Interestingly enough, weight loss, osteoarthritic pain, eczema, psoriasis, these are some of the other health benefits, and also antioxidants, very high in antioxidants as well in terms of this health benefits. So this is something that is underappreciated, I feel, in a lot of people. To actually, so it's not going to be significant weight loss, but to help moderate your, so not to gain too much weight. So I think the actual literal weight loss.
Yeah.
So olives and figs. So Allah subhanahu wa ta'ala, Surah At-Teen, بعد أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم والتين والزيتون. One of our, all of our children and ourselves, inshallah ta'ala, we know this verse where Allah subhanahu wa ta'ala swears, where he says the wa, swears by the fig and the olive. Teen was zaytun. So this is really drawing our attention to these two food items. And the fact that, let's start with the olives. Vitamin E. So it's very high in vitamin E, which is a very well-known antioxidant. Multiple established benefits for skin, heart, osteoporosis, and as a result of it being antioxidant, cancer reduction. Believe it or not, hair benefits, memory. So this is something that I didn't actually know before preparing this. Hair benefits, memory, and stress relief. So if you want to get some more stress relief, God willing, pop some olives, make the dua, and maybe your stress will be relieved even more. So Surah Al-Nahl, so the surah for the bee, verse 11 specifically, he also references the olive there. And then if we go forward to the fig, again, the same verse with tini wa zaytun. Figs are high in potassium. So this is something very interesting because they're having a dual benefit by the fig, where not only is the antioxidants, and we've said that a lot, so we won't go more into that in terms of the cancer benefit, but also the heart disease benefit with potassium helping really expunge out the excess sodium in the bodies. It's fiber rich, that's expelling the sodium in the body. The potassium is helpful for blood pressure, heart disease, stroke reduction. It's calcium rich. And then some people somehow extract the benefit from the figs and they make a cream out of it, and you can have benefit from psoriasis and dermatitis. And there's all these very expensive creams out there for these conditions where people in the rest of the world are actually using figs and extracts and getting a lot of benefit for a fraction of the cost. And I believe this is the last one, honey. Last but not certainly not least, al-asal, the honey. So in Surah Al-Nahl, Surah Al-Bee, this is a big theme in that surah. Antibacterial, antifungal properties, rich in antioxidants. So we've already talked about the benefits of that. But there's a particular honey, and I want to draw our attention to this. If you didn't know, unfortunately, a lot of the honey that's sold in the stores, even though they don't list it in the ingredients, they add sugar to it. So it's purely unadulterated, unfiltered honey that we get from the bees. So it's more expensive to get it off, from the community in terms of people that grow the honey, not industrialized and so forth. But there's a honey in the world called manuka honey, and it's used in medical studies to treat wounds, antiseptic properties, tissue regeneration. So my point that I want to reference here is not only that there's honey in the world being used for medicinal purposes and so forth, but the honey that we have, we have to be careful about our source. And for me and my family, we need to do a better job in the fact that the honey that we have in the stores may not be the best source of the honey. So I don't know if you wanted to push upon that at all.
No, I agree. I mean, I think we touched on this a little bit earlier. So I was going to kind of conclude and give time for us to talk a little bit. But one slide that we kind of went over or we skipped is this slide. So in the Quran, it says, for every disease out there, we have created a cure. So these are some of the things that are found naturally. And I know it's a little bit small, that are actually now chemotherapy. So there's a lot of different extracts from different plant life that we now use as chemotherapy. So a lot of our derivatives for chemotherapies actually come from plants. So that was one of the reasons I included that one.